On today's podcast, we're discussing mammograms. It's a non-invasive way to check for breast cancer and other abnormalities. But what exactly does a mammogram check for? Does it hurt? What kind of mammogram should you have? We're joined by Leslie Kibel. She's the manager of the Kupferele Comprehensive Breast Center at Texas Health Harris Methodist Hospital, Fort Worth. She'll answer these and other important questions about mammograms and breast cancer. Coming up next.
Welcome to the Wellbeing DFW podcast. Each week, Scott Sams will cover a different topic on improving health and well-being in our North Texas communities. He will host interviews with physicians on the medical staff of Texas Health Hospitals.
Hi, I'm Scott Sams. Thanks for joining us today. Odds are you've been impacted by breast cancer, maybe through the diagnosis of a friend or family member. You may have even been diagnosed yourself. Statistics show 1 in 8 women will be diagnosed with breast cancer. Many don't even know that they are at risk. But there is one test proven to reduce breast cancer deaths, and that is a mammogram. Our next guest is here to talk about mammograms and how important they are in saving lives. Leslie Kibel is the manager of the Kupferele Comprehensive Breast Center at Texas Health Harris Methodist Hospital, Fort Worth. Leslie, let's start with a question that many women want to know. Does getting a mammogram hurt?
Many women experience some discomfort when having a mammogram. However, if you have good communication with your technologist, it shouldn't hurt. Let the technologist know if it's extremely painful. There are things that we can do to make the procedure more comfortable and easier for you.
What is a mammogram check for?
Mammograms are the gold standard for breast cancer screening. It's the tool that we use to catch breast cancer early, and catching breast cancer early is very important because it's more treatable if it's caught early on.
So, Leslie, what can the results tell us?
Having regular mammograms is very important. Monitoring your breasts from year to year is very important. That's why we recommend it's not just having a test once in a while. It's having those mammograms year after year after year. That way the radiologist can look at changes in your breast tissue. As women age, breast tissue changes. And with those changes, sometimes you can see things better and sometimes you can't see things as well. Having those regular mammograms allows us to see those changes and monitor those changes over time.
Technology allows for different kinds of mammograms. What kinds are there? How many different kinds are there and how are they different?
Terminology is very confusing, and there's a lot of words that get thrown out that people don't always understand. I'm going to try to simplify things. Most mammograms today, you've heard of a digital mammogram. Most mammograms are digital now. That's the difference between a film camera and a digital camera. We don't use the film anymore, just like everything's digital. Music's digital nowadays. So a mammogram is simply a digital x-ray of your breasts. You've also probably heard the terms, or may have heard the terms, screening mammogram, diagnostic mammogram. That's a little more complicated, but it's still fairly simple. A screening mammogram is a mammogram that's performed on a woman who is not experiencing any issues or breast problems. It's a regular screening test. You get the results in about a week, and it's very simple. A diagnostic mammogram is what we do when we want to take a closer look at something. You've either gone to the doctor and discovered a lump, your doctor's performed a breast exam and had an area that they want to take a closer look at, or you've had a screening mammogram and a radiologist, the person who interprets that mammogram, wants to take a closer look at a certain area. A diagnostic mammogram is what we would do at that point in time. The technologist who's doing the mammogram can use magnification. They can use different positions and take different images than you would normally get during a screening mammogram. The other thing with the diagnostic mammogram is you'll have those results before you leave. You'll know what your next steps are. And most of the time, the next steps are, see you next year for your screening mammogram.
Is there one kind of a mammogram that's better than another?
The new technology and the word that gets thrown around these days is 3D mammogram. It's a digital mammogram, just like most mammograms. And what it does is it allows the radiologist to scroll through the different layers of the breast like a book. It takes different images of different layers, takes multiple images of the breast. And using that, the radiologist can then, much like a CT scan versus an X-ray, with the CT scan, you have a lot more images, you have a lot more detail to those images. The 3D mammogram has a lot more detail to it. It's federally approved. It's FDA approved for everyone. Anyone who has a screening mammogram or a candidate for a mammogram can have a 3D mammogram. At my breast center, we recommend that everybody has a 3D mammogram. It is especially shown to be especially effective in looking through and looking at dense breast tissue.
What about if you have that dense breast tissue? Is it harder?
Dense breast tissue is harder to see through. The x-rays don't visualize the tissue as well. So it's harder to see, and it's a challenge for the doctors to look at. The best test right now that we have is a 3D screening mammogram. Depending on how dense your tissue is, you and your doctor would make a decision as to whether or not there's additional tests that you may need to monitor and make sure that you're not developing breast cancer.
How young should a woman be when she gets her first mammogram?
The guidelines are all over the place, and I know a lot of people have heard 40, 35, 55, 45. I mean, it's all over the place. What we recommend is if you are in your 40s or approaching your 40s, you need to talk to your doctor and make a decision about whether it's time for you to have your mammogram. We follow the American College of Radiology guidelines, which is also the Society of Breast Imaging guidelines. That recommends an annual mammogram, annual screening mammogram, beginning at age 40.
Can a woman be too old?
The guidelines differ here as well. A lot of times, once you're about age 75, you and your doctor can make that decision whether or not you should continue getting a mammogram. The American College of Radiology and Society of Breast Imaging say keep on going with them.
What about women who have implants? How does that change a mammogram, or does it?
A mammogram is still a mammogram, and it's still important, even if you do have breast implants, to still get that regular screening mammogram. We do some slightly different things during the mammogram process because the implant can interfere with how the radiologist can see the tissue, but you still need to have a mammogram.
Let's talk about overdiagnosis. Is this test something a woman should consider to be optional, or is it something that's absolutely needed? I know you said that you recommend a woman at the age of 40. Is it an optional thing, or should everybody do it?
I'm in the business, so of course I'm going to say it's not optional. I get my mammogram every year. I encourage my mother to get her mammogram every year. It's something that I do personally for my friends and family. I believe in it, and I've seen the difference that it makes in people's lives. So I personally highly recommend it. That's one of the reasons that we follow the guidelines that we do.
Let's talk about breast cancer itself. Are there risk factors? I know from personal experience that it can be hereditary. My sister-in-law had breast cancer and had a double mastectomy, but my wife is fine. Their mom was fine, but their grandmother had breast cancer.
There are risk factors that we can control, and there's risk factors that we can't control. Family history, we can't control that our mothers or grandmothers or aunts have had breast cancer. At the same time, if you do have that family history, you are a higher risk in general of developing breast cancer in your life. That 1 in 8 chance improves to a 1 in 5 or 1 in 4 chance of developing breast cancer. There are also factors that we can control, though. Nobody likes to hear it, but diet and exercise and weight management are big ones.
Really?
They are.
Genetics, we talked about that, does play a role. Obviously, not everyone diagnosed with it, though, has that family history. And I'll tell you, my question would be, as an adopted person, what about a woman who was adopted at birth and doesn't have a family history?
The main thing is that to have that conversation with your doctor, make sure that your doctor knows what's going on in your life. Make sure that if your doctor knows that you don't know your family history or that you have family history that's unavailable due to parents passing away or aunts passing away, you may not know. I don't know why my grandmother died, but my doctor needs to know that I don't know that. With that in mind, you and your doctor can come up with a strategy for screening for breast cancer that meets your needs, that meets your risk factors.
The more information that you provide, the better.
The better decision that you can make with your doctor.
Right. How do you recommend that women talk to their doctors about their own risk?
The big thing is to suck it up and actually just have the conversation. So many times we get rushed and we get in a rush when we go in with the doctor. You know, they're in a hurry, you're in a hurry. Sometimes you just have to stop and you have to take a breath and say, hey, let's talk about whether I should have a screening mammogram or not. I'm confused about the guidelines. My aunt had breast cancer. What do I do? Does this mean that I am at a higher risk of having breast cancer? Have those discussions. Doctors want to have those discussions with you and take the time to educate yourself about what we need to do to meet your needs to screen for breast cancer.
Isn't it funny when you bring up a great point? When we go into the doctor, we feel like we've got to hurry because the doctor only has so much time. The doctor feels subconsciously or consciously that doctor has to hurry because it only has so much time. But it's the one place where you want to take your time.
You do. And your doctor is there for you. That time is dedicated to you and to your appointment. So take the time to ask those questions.
Breast cancer mostly affects women, but men can play an active role too with breast cancer screenings.
Right now, there's not a recommendation that men get screened for breast cancer. We do occasionally perform mammograms on men when they're experiencing an issue. All humans have breast tissue, and cancer doesn't discriminate male or female. However, it is more common for women to have breast cancer, which is why the recommendation is that women have screening mammograms. Men, pay attention to your wives. Make the time for them to get to those appointments. Help them, encourage them to make those appointments. Encourage your mothers, your sisters, your daughters, your wives, your girlfriends, or even your neighbors. Encourage them to take the time to take care of themselves. Getting a mammogram is taking care of yourself. It's not taking care of everybody else.
Yeah, and it's taking care of the people you love.
Yes, it is.
What's the biggest misconception that people have about mammograms?
Well, we've talked about two of them already. The pain factor. We hear from a lot of women that they don't get their mammograms because they're afraid that it will hurt. Don't let that fear rule your life. It shouldn't hurt. It's not a comfortable exam. I'm not going to lie. It's not the most comfortable procedure to have, but it's important. And it shouldn't be extremely painful. If it is extremely painful, make sure that you're talking and you speak up for yourself and talk to the technologist who's doing the exam. There's things that they can do to make it a little more comfortable and to speed it up and make it go faster so that you get it over with quicker. The other misconception that we've talked about already, again, is that I don't need a mammogram or I don't need it as often anymore. And that's really a decision that you need to come up with your doctor, but there are no recommendations out there that say that women should not get mammograms. So at some point in your life, sometime after age 40, before the end of your life, you should be getting mammograms regularly.
And that'll do it for today's podcast. I'd like to thank Leslie Kibel for joining us. We appreciate it. Texas Health is partnering with you for a better North Texas. To hear more Wellbeing DFW podcasts, visit our website at texashealth.org/podcast. I'm Scott Sams. Thanks for being with us.